Welcome to the Art of Communication. This webinar is brought to you by Can Multiple Sclerosis. Thank you to our viewers, our speakers, and all of our sponsors who have supported this webinar series, as well as our other young adult resources. Tonight's speakers are Lucy Carriere, a psychologist from Las Vegas, Nevada, and Mandy Rohrig, a physical therapist from Syracuse, Nebraska. Our learning objectives for this webinar are to have participants and support partners understand common skills and considerations involved in effective communication, recognize common barriers to communication, including MS symptoms, and build a toolkit to manage common communication challenges that young adults face, including communicating with their healthcare team, talking about difficult emotions, including anger and fear, to loved ones, asking and receiving help, and communicating with kids, friends, colleagues, and acquaintances. Lucy, could you start us off by talking to us about what makes for effective communication?
Effective communication, right? Really kind of at the heart of it is really kind of understanding the emotions, the intentions of what we're saying, of what we're doing, all of the behaviors you were talking about really communicate in a very powerful way. We know that nonverbal communication can account for so much in terms of how we exchange ideas and emotions and messages with one another, such that it really does serve as the foundation for a lot of our relationships and how we build trust and how we build intimacy and how we express our vulnerabilities to others. And so we know that for relationships, particularly those that are close to us, we really need it in order to sustain intimacy and ways of staying connected. And so the other side of that, though, is there's challenges with how we communicate, particularly with, is your message being expressed in the way in which you want it to be heard? So that really does go back to, am I communicating in a way that my receiver can understand that? And thinking about how are they learning? How are they receiving what it is that I'm stating? And is that message really being heard in a clear way that doesn't have a lot of distractors or noise, kind of reducing the message and the quality of that? So we want that communication, what it is that's being said, to really open up the door for that other person to hear and to be able to respond. So when we think about our communication, we really do think about that balance, right? In terms of the individual that's speaking, as well as how is the other person on the other side, how are they hearing that? And are we listening enough in order to understand their perspective? So it really is a balance. And I think that's the challenge is, am I talking too much? Am I not talking enough? Or am I not being clear enough? And really kind of how does that factor into how am I hearing that person? How am I showing that I'm listening?
So we like this cartoon because it illustrates the first aspect of communication we like to talk about. So for those of you who have called in, I'll read this to you. It's a couple sitting in their living room, and there are thinking bubbles, and the wife's thinking bubble says, when you've been married a long time, you get to know what the other person thinks. And the husband's thinking bubble reads, no, you don't. So let's start first with listening tips. Effective communication starts with good listening. So let's start with interruptions. It's important to let individuals finish their thoughts, especially if cognition is a challenge in MS, for those living with MS. Trying not to multitask. I am very guilty of this. I am a mother of 3, and I am inevitably multitasking all of the time. I can be cooking dinner and barking orders to my children, and I wonder why they're not hearing me. If I'm not even looking at them, they're of course not going to think that I'm listening if they're talking back to me. So trying not to multitask. Forgetting to turn off the TV or putting down the phone, limiting our distractions. We live in an environment right now, a society where there are lots of distractions, and we're all guilty of it. I think looking at our phones and when someone else is trying to communicate to us and not fully giving them our attention. Jumping to conclusions. Perhaps an example might be if the person with MS is sharing their challenges, maybe with a symptom. We'll use fatigue as an example, and the loved one jumps to the conclusion of, oh, so you're fatigued, let me help you. Let me take care of this for you. You just go rest. So just assuming that they needed help and wanted help, but maybe the person with MS just wanted to vent a little bit. So jumping to conclusions. Switching the focus to yourself. So again, we'll use fatigue as an example. Oh, well, I hear that you're tired. Well, I'm tired too. How many times have some of you heard that, right? Not the same thing. Not the same thing. And lastly, trying to read his or her mind. So that's something you also shouldn't do, because that can lead to more interruptions or misinterpretations of what someone's trying to communicate. So Lucy, if those are the don'ts, what are some of the do's? Yeah.
Right, and those really do, excuse me, lead into thinking about how do we communicate effectively. And really the biggest part of the effective communication is how do we become more engaged? How do we really try to show some of those really fantastic listening skills? Because unfortunately, sometimes being a good communicator isn't instinctual. So we want to think about your body language, right? As you were talking about the multitasking when you're trying to talk to your children, or when you're trying to talk with those people that are really important to you. Are you looking them in the eye? Are you making sure that the distractions are reduced as much as possible, right? Are you trying to be mindful of kind of what their face is telling you, right? So somebody might be sitting across from you and saying, I'm fine, but you see tears rolling down their face. So maybe in that moment we think about asking and stopping and saying, what's going on? I see tears. Are you crying? Are you sad? What can I help you there? So again, kind of using the nods, using the prompts, asking questions, clarifying. I think that's one of the biggest ways that we can show that we're engaged in listening. So when you were mentioning the fatigue example, instead of saying, gosh, you're always fatigued, this is just a way for you to complain all the time, this is all you talk about, maybe instead it's, well, tell me what your fatigue feels like. What is that? Give me some descriptors. Give me an example of what that might be. So I hear you say this. Again, it's showing that you're engaged and that you want to learn more. Again, taking it, clarifying it, stopping and saying, okay, this is what I'm hearing, right? And really kind of, again, trying to identify what's the emotion underlying what they're trying to say. So they might be explaining just a really chaotic day or really problematic with fatigue and mobility and getting around. And instead of maybe responding to the content, maybe you say, sounds like you've had a really challenging day. I bet you're really frustrated. And seeing how that might, again, increase that intimacy as you're listening, right? As you're showing them, I'm here, I'm engaged.
So as a nice lead into talking tips, we'll introduce it with this cartoon, and it's two frogs sitting together, and they're saying to each other, can't we just talk without you dissecting every word I say? So talking tips, what are some things we should not do? We should not, or we don't want to overgeneralize and use specific statements like you always. So, and we'll talk more about this later in the slides, but an example might be you always forget to take out the trash, or you always leave the dishes for me to clean up. There's a good possibility that it always isn't the proper descriptor, so overgeneralizing. Dripping with sarcasm. Again, this could be misinterpreted, right? It could be a little insulting in some situations, so it's better, especially when you're trying to have a serious and important talk, to not incorporate sarcasm. Again, there's that multitasking. We should try not to multitask when we're talking just as much as we should try not to multitask when we're listening. And then lastly is the mind reading or casting assumptions or criticisms. Again, this can lead to more misunderstanding and hurt feelings, and again, set the tone for the whole conversation in a really, perhaps a negative way. So if these are the don'ts, Lucy, what are some of the do's?
Yeah, so we really want to emphasize kind of setting aside time to talk and how important that is in our day and age with so many distractors, so many responsibilities and roles that individuals living with MS and their support partners and their family members are dealing with. So it can be distracting to have conversations. So schedule a day, schedule a time. Maybe you reserve each evening after kind of things have wound down from work, or your day is kind of now in a bit of a more quiet period, and that's when we talk, right? I think too, it's important that as you're having these conversations, right, you're acknowledging that you and whoever it is you might be speaking with, you have differences in how you communicate and how you work through it. So the goal isn't necessarily to avoid conflict. That's inevitable. We're all going to experience that. But let's think about it more from the perspective of how can we work through it when we're having these disagreements, and acknowledging I might want to talk a lot about it, or I might need some time to calm down, then we can revisit. It's finding kind of that compromise within that relationship. And you will hear Mandy and I talk quite a bit over the next hour with the power of I statements and how that can really be a strong tool in communicating exactly what it is that you might need, communicating an emotion with it, and what it is that you're hoping to get out of it, such that it's a way to kind of de-escalate, a way to kind of disarm another person when you're having a disagreement, but really wanting to get your message across. So we love the I statements, the we statements as well, and the power that those can have within communications within relationships. And so as we're listening, right, as we're clarifying, that's one thing that, again, we want to utilize over and over as we're having conversations with not only those who are close to us, but thinking about relationships, colleagues, maybe at work, or your healthcare team, as we'll talk about in a little bit later. But utilizing those good skills, showing individuals, showing others that you're listening. So, you might kind of recap it with, so I heard you say this, or, okay, this is what I've heard thus far. Is this getting at what you're stating? Or it sounds as though you were thinking this. Is this accurate? And so that's really giving them an opportunity, the other person that you're communicating with, an opportunity to clarify, well, actually, no, but you were close. Here's what I was thinking, or what I was feeling. And so these are good skills to use regularly as you're having conversations, and not to kind of wait till the very end. But I would encourage you to utilize it often as a tool to continue facilitating the conversation. So with those conversations, oftentimes it can get challenging, right? Particularly in close relationships, when emotions can really become a strong factor. And oftentimes, right, when we're feeling particularly anxious or we're angry, it might be really challenging to have these big conversations, or even small conversations. They can be a big hindrance. And oftentimes when we're experiencing really intense negative emotions, we might have more of a higher chance of misreading others' emotions, right? We might have a lot of nonverbals, so that when we're angry, we might have a tendency to cross our arms, which again is going to not probably facilitate a conversation when somebody sitting across from you has their arms crossed and their brows furrowed. We're probably not as patient, right, when we're feeling one of these particular emotions. And so again, we want to think about and check in, where are you at feeling-wise, emotion-wise, as you're communicating? Is it becoming a little too intense, right? Are you kind of hitting a tipping point where now it's becoming an impediment to the conversation? And so I think that's really kind of where that self-awareness comes into play, and kind of knowing yourself and knowing when, all right, maybe it's time to kind of take a break right now. And so one thing we like to remind ourselves is that just because there's some silence, or that you might need to take a break and revisit the conversation, it doesn't mean that you don't care or that you're not being loved. It's maybe that individual, for the purpose of the conversation, really does need that break. And then you come right back at it. You schedule a time that, okay, you know what, in an hour, let's have that conversation. I think I'll be more present and able to kind of have that discussion.
I like what you said, Lucy, about scheduling that time. I know I've had some patients talk about when they want to have a very personal conversation or a very serious conversation with their loved one, then if they schedule that time, they're prepared for that time, and it's a really more of an effective conversation. So I like that you mentioned that. In addition to the barriers that Lucy just spoke of, MS adds a whole nother challenge to the equation. MS symptoms in particular can really magnify communication challenges. I'm sure Lucy sees this all the time in her work. For example, say it's the end of the day and you're experiencing a lot of fatigue with your MS, but your partner wants to talk and share all of the wonderful things that happened to them that day, but they're at the end of the day, and you as a person living with MS, you may have no more emotional energy left. So that's hard. That's really hard, and that can be a barrier. Or another example, more in the workplace, might be, say you're in a really big meeting, and maybe it's one of those mix and mingle types of meetings where you're standing around a lot. But standing for a long time causes a lot of fatigue, maybe causes a little balance issues, and you find yourself concentrating on those other MS symptoms, and you don't have that cognitive space left for communicating or socializing with the people that you're with and around. So MS symptoms can be a real barrier, and it's really important to talk about how to optimally manage those symptoms with your healthcare team, especially if they're interfering with daily life. In addition to MS symptoms, sometimes it's hard to communicate about them because there's no common language. Maybe you just don't know how to talk about this or talk about whatever that symptom is. And again, invisible symptoms such as fatigue are good examples about that. I think when people say, I'm so tired, lots of times folks don't understand that MS fatigue that folks living with MS feel is a lot different than the tiredness that anyone gets after a long or a busy day. So Lucy, what else? What are some other barriers that exist?
Yeah, and I think this really leads into different ways in which you might discuss MS, or even the way in which you've coped with it. There might be some differences between you and some of those who are close to you in your life. So thinking about that individual who wants to talk about it and wants to tell you all about their symptoms each and every day, whereas maybe somebody close to you is more, you know what, just let me know if something comes up, or if something's really bad, then you can let me know. I don't want to know too much. Or when you think about kind of maybe those who are more newly diagnosed, and it's, I can't get enough information, and I'm reading and I'm scouring as much literature as I can, whereas maybe somebody else in your life might say, I really don't want to know that much. Again, need to know basis, right? So I've seen tremendous variability within my practice of how individuals cope with it in terms of the diagnosis, learning about the disease, even how they continue to talk about the symptoms on a day-to-day basis. And so I think the key will be, how do you maintain that balance that we talk about within that particular relationship, and really knowing the other individual or that family member in your life that you share that with, and what works for the two of you, and having a discussion about your communication and how you want to talk about it. Certainly, in the same light, we want to also acknowledge just the role that mood can play in terms of communication and depression, anxiety, anger, a lot of the symptoms that we know are slightly more common within an MS population than the general public. We want to think about that. We want to acknowledge that those can certainly be particular challenges as you are communicating with others. Also, too, we want to give light to the cognitive challenges that might come up as you're communicating and trying to kind of process all this information, and emotions might be running high. And so there could be a lot of challenges or barriers that can get in the way of really clear, concise communication where you're feeling heard.
So now that we've kind of laid the foundation to communication, we want to talk about specific communication conundrums. So we're going to move forward with specific quotes, and you can see the first one here, that illustrate communication challenges that are unique to young adults living with MS. So here's our first one. I am angry that I have MS. We have heard this before, right, Lucy? So how do we communicate to others our anger, concern?
Yeah, so that's a big one, right? And we could kind of place in any kind of, I think, negative emotion as it relates to, I have this diagnosis, and kind of the injustice and the unfairness that might kind of bubble up for some people. But, when we think about anger, we want to tell you that that's normal, right? We want to normalize it and say that it's okay. It's not an emotion you need to push away or not feel. And in fact, we want to talk about it, right? We want you to find that safe person that you can open up to. And I think a big part of that is not letting it fester, right? Because oftentimes when you have anger that isn't acknowledged or isn't discussed, I think that can lead to resentment. And can lead to a lot of other negative emotions, and can certainly, as you all can imagine, can bubble over, as we've seen kind of in a kind of a clinical sense. So when you're thinking about, how do I express that anger? Who can I talk to? I want you to think about your audience, right? Identifying those individuals that you feel safe with, that you can be vulnerable with. I think that's a big part of this. You're opening up and really exposing some intimate parts of yourself. And so without a safe environment for you to be able to express it, you're less likely to really kind of share everything that might kind of be related to that too. So when you're thinking about kind of discussing your anger and kind of what to do with it, right? We want to think about ways in which you can manage that. If it's becoming so high that it's impacting your day-to-day life, right? We want to think about ways that can help with soothing yourself, maybe even continually monitoring it if you feel like it's going on for a while, and really giving some thought to how is this affecting kind of my day-to-day life? Is it negatively affecting my relationships, my ability to work, my ability to concentrate? It takes a lot of physical energy to be angry. And so when you're talking about living with MS and you're already kind of running on a little bit low with energy levels, this can really have a huge impact on your fatigue. And so that's something we want to be ever mindful of in terms of, okay, where are we at with this anger? How consuming is this? And can we take a break from it? Can we think about maybe professional outlets for better managing it if some self strategies aren't as effective as you'd like? So certainly, Mandy and I touched a little bit on some of the unique communication challenges that come with living with MS, and to revisit some of the cognitive changes, which we know affect up to 65% of individuals living with MS. So when you're thinking about some of the cognitive difficulties that individuals with MS might be living with, we want to think about some of the cognitive symptoms that might be more common within an MS population. So in thinking about how you're processing information and content that is coming your way, we want to think about how can we maybe slow the pace of the conversation, right? Emotions might be high. So already it's going to be challenging to maintain your attention such that you can really hear the person, because we know that when we communicate, listening is the biggest part. And so we need to make sure that we have those capabilities with our attention so that we can hear, so that we can relay back to that individual. So it might be helpful to kind of what we call chunk it, such that maybe you take small pieces or small aspects of the topic and discuss, and then come back later on to revisit the rest. It might be a little overwhelming for somebody, again, that might have a little bit trouble tracking the conversation, to discuss really big topics in one sitting. Also, too, again, thinking about that relationship with fatigue and how that might be negatively impacting things. Another thing, too, I think is really important and goes to just the core of good communication is stopping very often and, again, clarifying what you're hearing. Emotions might be high, fatigue might be there, attention might be a little bit more difficult. Same thing with memory. So we want to think about how can we utilize those good skills and say, okay, I'm struggling a little bit right now. I'm not able to maybe attend to as much as what you're saying, but this is what I've heard so far. What are your thoughts? Is this what you're thinking as well? Help me to understand. Another thing too to kind of think about is sometimes it's important to kind of know those individual strengths and weaknesses. And this is where, if you've had formal neuropsychology testing, that might kind of give you a sense of relative strengths and weaknesses you can think about as it relates to your overall thinking skills.
I'm just going to comment too, if you do have that neuropsych testing and they do identify those strengths and weaknesses that Lucy spoke of, you can work with a psychologist, you can work with a speech language pathologist, someone else on the healthcare team can kind of help you practice those strategies and figure out ways how to implement them practically into your life. So that's a good suggestion. Support partners. Let's move on to the next conundrum. Support partner. You are always tired. How can I know if it is the MS or if you are just tired of me? Lucy, what would you suggest?
That's a tough one, right? When you think about all of the challenges and this very invisible symptoms that we've been talking about as it relates to living with MS and how those might be perceived within close relationships, romantic relationships, friendships, family relationships. And so how do we really kind of figure out what's going on such that that other person isn't necessarily kind of internalizing that and assuming that I'm at fault. What's wrong with me? I see you're upset. I don't want to jump to the conclusion that it's me that's caused it. So some ways we might kind of get around that is, when we're trying to communicate what it is that we might need, instead of saying, well, you just need to be more, or why don't you change this about yourself, we think about the behavior. And I think in a way it kind of depersonalizes it in a bit, but in a good way, such that that other person may not be as apt to become defensive and want to defend themselves. So you might ask how they might alter a particular behavior as opposed to targeting their emotions or their personality or kind of who they are. Again, how can we be as clear as we can in communicating what it is that we need? So one example might be, I really would prefer if you were more patient with me when we're walking into the store, or I really wish you might check with me before you make plans for our weekends. Last weekend it was a little too much. I know you want me involved in a lot, but because of my fatigue or my pain, for example, I really would prefer you ask me first, and then we can decide together. So the key really is being as specific as possible, but also too, I think a big part of this is providing feedback to that individual. Again, showing that appreciation for what they're doing, and they might probably have very good intentions, but you need to be able to communicate how that's affecting you physically, and specifically what that looks like for you and why it was a challenge and how you'd like to see that kind of moving forward, or that improvement. So again, we want to be mindful of not only what it is that we're saying, how specific we're being, but how we're saying it. Thinking about that tone and thinking about kind of your nonverbal ways that you're saying, no, this is how I would prefer it, and thank you for this, but being mindful of all of the ways in which you're expressing yourself. So here, Mandy and I thought about some different ways in which we could turn a complaint actually into a request that's maybe a little bit more positive. So one way we thought about this is, instead of saying, well, gosh, when I get home after work, you don't even say hi to me, and I just feel like you don't even care if I'm here or not. And so with that, right, the other person might instantly kind of get on the defense and want to defend themselves. And so one way we might transform that in just a couple really simple ways is maybe we say, in the future, I would like for you to say hi when you get home, and a hug would be great, right? So you're identifying what it is that you want in a very simple behavioral way, right? And letting them know how it made you feel. It makes me feel loved when you do that, right? Another example that we thought about was, instead of saying, you don't know what it's like to have MS, right? So again, less emphasis on what it is that you're needing, and it's more kind of in this as kind of blaming stance. So we might say, to your support partner, for example, I understand that MS affects you too, but in a different way from how it might affect me. And I would love if you could ask me regularly how I'm doing physically. Again, you are letting them know specifically what it is that you need. And that's how you're starting to build those inroads into helping that other person understand what it is that you might need.
So moving on to the next one, a common challenge for young adults living with MS. I am afraid if I tell my friends and colleagues that I have MS, they will treat me differently. How do we communicate this fear about communicating the disease to others? Lucy, do you have any suggestions?
Yeah, so that's a big one, right? And so we want to think about really kind of who your audience is, right? So when you're talking about MS, when you're talking about the symptoms that you're experiencing, we know there isn't kind of a one size fits all. And so you're going to have different reasons for why you disclose, and you're going to have different individuals, different types of relationships that are going to come up when you think about disclosure or talking about your MS in general. So in general, I think it's wise to be thoughtful in how you approach that, who you talk to. Is it a workplace colleague? Is it your neighbor down the street? Is it a friend from your yoga studio? Again, somebody in your family. I think it's wise for you to be very thoughtful and want to be maybe even hesitant sometimes with how you go about disclosing and who you might talk to, because again, you want to be protective of that information. Once you disclose and you talk about it, it's hard to take it back. So again, you want to kind of think about, first and foremost, just the nature of that relationship, right? Again, the safety really comes into play. Do you feel safe enough within this relationship to share this aspect of yourself, right? And so again, thinking about what is it that you'd want that other person to know? What is it that you'd want them to understand about your experience with MS? It's going to be different. Maybe for you, it's really important to talk about pain and how that neuropathy has really affected you. Or maybe you want to really emphasize the cognitive changes that you've experienced. Another aspect is thinking about the best way to do it and how you go about having that conversation, right? As well as what kind of responses do you think you might get, and trying to kind of anticipate that, I think, can be important, at least giving that some thought. So overall, how you talk about it is going to be different for everyone. and really thinking about what's the purpose of it. Is it to build intimacy? Is it for us to think of the future? Are you trying to maybe discuss it as it relates to workplace accommodations, for example? Or do you just want that individual to know you a little bit better? So those are just good questions. The National MS Society has a really great tool for how you go about thinking of that, and really kind of weighing the pros, the cons, to talking about your MS. So I would encourage you to look into that.
And one other additional word about disclosure more broadly, I think we need to be sensitive, since there are so many different ways that we can communicate nowadays, specifically in the arena of technology. We just want to be sensitive to things that are posted on social media, or that others who may know about our MS post to social media, or what can be shared, and if that's seen. Just have a heightened awareness, if you haven't disclosed to everyone, what your social media appearance might be like, if you're not comfortable conveying that to everyone you are friends with, or everyone that you're sharing that social media world with. We'll move on to the next one, support partners. So I am so exhausted from all that I do at home. I wonder if she or he even notices. So the support partner is feeling overwhelmed and exhausted. How can the support partner communicate his or her needs differently?
Yes. So again, this is a big topic, right? When we think about MS and how it affects relationships and how it affects the family. We know that MS isn't going to occur in a vacuum, and we know it's going to affect all of those that are pertinent to that individual's life. And so we want those close individuals in the lives of individuals living with MS. We want you to feel empowered as well to talk about what your needs might be and how that individual with MS can help you with those needs. How can the relationship maybe feel a little bit more balanced, when oftentimes in my practice, I've encountered situations where it more often than not feels imbalanced. And so it's working on those strategies. But it starts with having the conversations, right? Having a place, having a time where you schedule, let's have this discussion. I think it's important for me to open up, right? Again, thinking and going back to the power of those I statements is really important when you're having these conversations that can be kind of heavy in emotion. And so we want to be mindful of that, and using just those core good communication skills to convey what it is that you might need. And so I think prior to having those conversations, you want to have a little bit of some soul searching and thinking from your perspective, well, would it be helpful if I just had more time outside of the house? Do I want to see my loved one having more participation at home or helping me with chores? And I think that's important, going into that conversation, knowing what it is that you need. I think can help that facilitate that conversation such that it feels a little bit more productive. And I think a big part of this that Mandy and I both see in our practices, and when we're presenting on this elsewhere, is really recognizing that over the course of the disease, things are going to change, not only for the individual living with MS and the symptoms that they're experiencing, but also to their needs, which of course is going to affect the support partner and how their needs are going to change. So what you might need early on in the disease might change 6 months, 6 years out. And so it's kind of a constantly evolving conversation that you have to revisit as needs arise and within the relationship parameters. And so it's important to let them know what you need. To also think about too, what does your support look like outside of your relationship with the individual with MS? Do you have other support that you can turn to? What kind of things are you doing outside of the house to kind of take care of yourself physically, emotionally, spiritually? Thinking about those activities that kind of recharge your batteries and fill your tank. Those are just as important and will help with kind of overall balance within that relationship.
I agree, Lucy. I think it's important to just emphasize those self-care activities, right? Like making sure that the person with MS, but also the support partner, right? We're talking about the support partner here in Lucy's suggestions, that they need to have a primary care provider. They need to be observing those well checks, making sure they're participating in preventative screening, vaccinations, proper diet, exercise, all of that really important stuff that we emphasize for our loved one with MS also needs to be a priority for the support partner too. So great suggestions. The next one, the next communication conundrum. My MS provider rarely looks up from the computer screen to talk to me. I have so many questions, but I feel so intimidated. You know, people who are diagnosed with MS, especially if you're newly diagnosed, you're kind of thrust into this world of MS with generally little warning and certainly without any guidance except from the guidance of all of these brilliant healthcare providers that are busy and don't always have a lot of time. So how do you effectively communicate with a healthcare team that is trying to juggle a lot? So how do we communicate? We liked this quote. We think this captures it quite well. No matter how good a practitioner your doctor may be, if you don't understand what they tell you, or if they don't listen or clearly answer your questions, your care will not be the best it can be. So I like to kind of think of it like this. You know, you could have the best rated healthcare provider, the best neurologist, the best physical therapist, the best psychologist, but they may not be the best one for you. And that's okay. It's important that you find the healthcare providers that are most impactful, effective for you. And MS symptoms are very unique and personalized, and there's a lot to discuss with limited time. So it's really important to have that person that you're comfortable with, that you can talk to, and that's responsive in order to most optimally manage your disease. I almost like to think of it as a partnership in a way, you know. I guess you and the support partner, the person living with MS and the support partner, are kind of like the captains of the ship, if you will, and the healthcare team are the navigators. They're just kind of helping you navigate these unfamiliar waters. So again, find that healthcare team, find your best navigators that you can. So how do you communicate effectively with these folks? So a patient or a person living with MS and a support partner who optimally communicates with the healthcare team will be mindful of the healthcare provider's limited time. You know, as healthcare providers, we would always like to have more time with our patients. I'm sure Lucy would agree. But we do have limited time, and we want the best quality even when that quantity is limited. So we do appreciate that. We also appreciate and we feel it can be effective when the patient is concise in their communications. I am by far a person who enjoys a good story, but I also respect the fact that it's not always necessary, and what we want to get to what's most important and what's most key. So trying to be concise in that communication. It's also important, and we both want our patients, and all healthcare providers want our patients to ask when they don't understand something. Healthcare providers, especially early on in the disease when everything is so unfamiliar, may use jargon or different terminology that just may as well be a different language. So please ask them to repeat it and write it down. Go ahead, Lucy. Did you have something to add about that?
Yeah, I was just going to say that I think sometimes, maybe even early on in the disease process, I think it can sometimes be intimidating to go to these appointments. And so, you know, you might go in with the best preparation and the list and some of the strategies we'll talk about in just a few minutes to optimize those appointments. But sometimes maybe the emotions can get in the way or maybe be a barrier. So I think it's recognizing that sometimes it's okay if you're a little anxious, and if you feel like you need the doctor or the provider to slow down a little. I have told my patients so many times ask them to stop and maybe repeat that, or, you use this word, I don't think I quite understand that. Can you tell me a little bit more about that? Can you write it down for me, right? Sometimes it's a lot taking in all of this information by just listening to it, and it can be overwhelming. I think about my own doctor's appointments, and if I'm getting a lot of information, it can just be overload. So can you write that down for me? Are there some handouts that I can have as well to take home and review afterwards? So
And I love what you're saying, Lucy, because we have to speak up, right? As patients, we have to speak up. And I'm going to share just a quick story. My daughter is a transplant recipient, and I remember early on after her transplant, we were visiting a lot of doctors. And one doctor in particular was helping her with a skin issue that she had. And I remember him marching into the treatment room, and he didn't even look at her. He was looking at his file. He wrote a prescription for a stronger medication, didn't even ask questions, didn't look at us. And I physically moved my chair right in front of the door and interrupted and said, hey, like we have to stop. We have to slow down. We need to talk about this issue. So again, we have to be our own advocates. People living with MS have to be their own advocates in those situations.
absolutely.
So a doctor or practitioner who is a good communicator, they definitely need to have respect for their patients, right? Like, and hopefully you all feel that respect by the way that you're cared for, their postures, their tone, their eye contact. You'll just feel a warmth about that practitioner if you know that there's a mutual respect. The doctor or the practitioner should also have the ability to share information, again, with that limited jargon. They should not interrupt or stereotype their patients. You should feel that when you're in those visits that you are receiving care that's personalized and that's unique and addresses the problems that you want to talk about. And lastly, that doctor or that practitioner should also have that ability to effectively manage expectations. You should know what to expect from visits. You should know that number to call or how to reach him or her, both in urgent situations as well as non-urgent situations. Lucy, do you have any other tips, or does that kind of cover it all?
Yeah, I think really the biggest factor is, do you have trust in your provider, right? And when that relationship is built and you feel comfortable with it, you're more likely to hear what they're saying, to maybe take some of their recommendations to heart, or maybe consider them a little bit more if you feel as though they're invested in you and you as a person.
And that can change with a disease too, right? Would you agree, Lucy, that if a practitioner may be working well for you for a while, but then things change and maybe you need a change, and that's okay. That's okay.
Yeah, absolutely. And to think about too, our medical providers they're human too. And as much as we would love for them to be at the top of their game every single visit we see them, sometimes maybe they're having days where they're a little bit off. And so it's important, I think, to kind of acknowledge that and think about that, right? And over the course of your time with them and your visits, and overall, are you feeling heard? Do they understand you?
So these next couple slides we'll go through relatively quickly, knowing the fact that you'll have a copy of these. So how to make the most of each office visit. Before your visit, make that prioritized list of questions and issues. Certainly have your current list of medications. And we also encourage folks to bring a friend, a notepad, or some type of recording device, because there's usually a lot of information to process and remember. So that extra set of ears or that extra ability to record the communications is helpful. And during the visit, arrive early for your appointment, know where you're going if it's an unfamiliar place. Ask questions. Again, you're going to hear that over and over. Certainly don't be bashful in asking questions or taking more notes, and having them repeat back as you're asking those questions, just to ensure that understanding. Always ask for a written summary, and most physicians' offices and healthcare facilities do provide a written summary at the end of visits. Ask how to best communicate with the providers. I mentioned that earlier, to talk with them about how to reach them both urgently and non-urgently, and then confirm with your healthcare provider if it's okay if you want to record that. Some facilities do have some restrictions on that. And again, some other tips for making the most of each office visit: bring a copy of your medical records to share with providers. Some institutions do have the capability of sharing with one another, but that's not universal. So just, again, be your own advocate and have that copy of the relevant paperwork that provider may need. Check in with each provider at least once a year in order to sustain those relationships. We especially encourage this in rehabilitation, just to make sure that your physical health is being monitored closely. Authorize team members to communicate with one another. Usually that's a release form at each facility. And promptly report new or worsening symptoms. Again, it's best to not let things go without attention. Report it to somebody, even if it's not the healthcare provider who can immediately help you. Report it to someone on the healthcare team, and they can refer you to the proper channels. And lastly, alert your team members to financial or insurance issues. In the rehab world, particularly physical therapy, sometimes with changing insurances or changing plans year to year, copays can change from $8 a visit up to $30 or $40 a visit. So team members want to be sensitive to those financial constraints, so certainly let them know if that would change. So moving on to the next conundrum: I feel crummy, but I just hate asking for help. Lucy, how do we ask for help? It's tough.
Oh, it's so tough. And I think this is something that we hear so much from our patients, and not wanting to feel as though they're a burden. Oftentimes we hear that, if I ask for help, if I ask for assistance, or if I utilize that mobility aid, for example, it's just a sign of me giving up. It's a sign of weakness. And we would say to the counter, actually, it's a sign of strength. It's showing me some resilience, right? You're in this for the long haul. And so we want to preserve you as much as we can, and really reaching out and asking others for help oftentimes is a way to maintain your autonomy, because you're kind of starting to call the shots, and maintaining that independence and whatever that might look like for you. And so when you're thinking about how is it that I ask for help, I would ask, think about who it is that you're reaching out to. Is it the same one or two people that you always turn to? Are there ways that maybe we could broaden your network, or those in your village that you could turn to, such that there's less of that feeling of being a burden on others? And I think it's important too to think about too that a lot of those who are close in your life often like to feel useful and helpful. And so if you think of it as a burden by asking simple requests, for example, that could be a big barrier to them feeling like, well, I don't ever hear from them, or they don't ever ask. And so I guess I just assume they don't need anything, which, again, so counter to good communication and clarifying that. So some things to think about is being as specific as you can with what you might need. I think it really reduces the chances of misinterpretation or lack of kind of clarity with what's going on, what's the need. So maybe when somebody asks, instead of saying, no, I'm fine, I don't need anything, or if you say, well, yeah, I mean, you could check in with me every now and then, that'd be great. That other person might think, well, I don't know what that translates to. Could I bring them a meal? Could I stop in and take their dogs out for a walk if they're not feeling particularly well that day? Or maybe I run to the grocery store. Do you have a list of something that I can pick up for you? So I think it's kind of having that set list there, that if someone were to ask you, what is it that you'd say? Practice it. It can feel a little awkward when you ask people to do things for you. So think about how you might word that such that it feels more like yourself. And of course, right, giving them that feedback, or maybe it's something unexpected that somebody did for you, and it's acknowledging that, hey, I really want to thank you for watering my flowers when I was gone, or taking care of my kids for me, for example. So it goes a long way. And when we think about asking for help and utilizing those in your network, because this isn't something we want you to fight alone, if we have to do it a little bit differently, well, then that's showing me that you're making adjustments, right? That you're flexible and working towards building that resiliency.
So the last communication conundrum we're going to address is that of a child of a person with MS. So the quote reads, "Mommy is always tired. I don't understand why she doesn't want to play with me." Kids, Lucy, how do we talk to kids?
Yes.
Yeah.
It's tough, right? And we could spend hours kind of talking about this topic, but I think it's important for us to highlight, right, as we're talking about the importance of communication. How do we gear it to those who are still learning how to manage their own emotions, how they're even learning vocabulary to describe what they're feeling? I think it poses a lot of challenges, right? But when we think about how we communicate MS and symptoms to kids that they may not be able to see, we want to think about the fact that we know they're pretty resilient, and oftentimes kids are a lot stronger than we give them credit for. Another thing too, kids are pretty perceptive. So if we think we're doing a good job keeping them in the dark and not putting a name to something, oftentimes kids have a sense of what's going on. And depending on their age, oftentimes the younger ones can misinterpret that and developmentally might assume something's wrong with me, I did something. So it's part of, I think, when you think of MS and how it affects families, it's important to kind of think about, how are we going to talk about it? How are we going to adjust this complex medical terminology to things that are really age appropriate and developmentally? What is it that my child can understand? So what's their personality like? Do they like a lot of information? How do they learn? Is it talking about it and really kind of understanding the emotions behind some of their questions? Or is it, I want to give you some information, read over it, let's talk about it, perhaps with maybe those of you who have children who are teenagers, for example. But I think being mindful of how much information we're sharing, right? This is a lifelong disease, and it's one that maybe we need to think about. Can I just give them chunks? Can I give them kind of, at this point in time, it's important for them to know about this, and then later on, maybe we can talk about mommy's pain, or how it affects dad's fatigue level, or his ability to walk sometimes, right? Giving them too much might kind of backfire a little bit. So thinking about, how do you talk about MS in your family? What's the shared language that works for your family? How do you put labels to it? And we've included some resources here that the National MS Society has published that are really fantastic and geared for children of all age levels. And so I think it's helpful to look at as it's relevant, to give you some maybe talking points for your family and with your children.
So hopefully during the last hour, we've given you all a couple things to think about that have been helpful. But we want to wrap up with this quote from a couple who participated in an in-person program for young adults that we had last month. And this couple so eloquently said, MS is a we disease, not a me disease. So it just so concisely conveyed that MS affects both people, and we have to be able to talk about it. We have to be able to communicate the feelings and the challenges associated with this disease. And we'll leave you with this last slide that just is a nice summary and a reminder of all of those people who are available to help you as you journey through your MS. Thank you all, and we'll pass the baton back to Brian to wrap us up for the evening.
All right. Thank you so much, Mandy and Lucy, for those great scenarios and tips, and certainly communication. It's something that we take for granted, but it's important to take a step back and look at the different scenarios in which we're communicating with all sorts of different people and to be able to adapt and be mindful of what we're trying to communicate. So thank you again so much, everyone, for listening tonight. We are going to have a few minutes for questions here. So in that question box, you can submit some questions. We'll try to get to as many as possible. And again, I'll let you know of other ways to submit questions to Can Do MS. But while we're waiting for some of those questions to come in, I do want to let you know two things. First of all, as soon as we're done here, you'll see a survey pop up on your screen. And it's really important that we try to get as much detailed feedback from you as possible. This is how we know how we're doing, what information has been relevant, what you hope to do with this information, and also what we can do better and what we can improve upon, and what information you wish that you had heard. So please take a few minutes as soon as we're done here to complete that survey. And then also just a reminder that this is part of a series, and there are 2 other webinars in our young adult series, one on investing in your future and one on staying active in an unfamiliar body. So if you go on to the Can Do MS website, you'll be able to view all those archives, and hopefully it's a nice complimentary series to give you some ideas and some tips as we move forward and try to live our best lives possible with MS. And also, in addition to that, there are 3 podcasts in our young adult series that just got released today. And there's a young woman with MS that tells her story and really touches on the 3 topics of the webinars that I just discussed. So you can go online and download those podcasts at Apple Podcasts or wherever you listen to podcasts. And those just got released today. So it kind of adds a nice human element and some stories to some of the concepts that we've been talking about through this entire webinar series. So with that in mind, let's go ahead and move on to some questions. We talked a lot about barriers to communication and how prevalent those can be. And the 2 biggest barriers that people ask questions on was on fatigue and physical exertion, and also cognition and memory. So let's start with Mandy here. We talked a lot about fatigue tonight, but specifically, do you have any tips for when you're just so wiped out and you had one of those MS days and it just feels like the weight of the world to just to open your mouth and to talk? How do you kind of overcome that overbearing exertion to be able to still communicate your needs and wants and having that back and forth dialogue with your partners?
Yeah, so fatigue is tough. It can be really debilitating and limiting for a lot of people and a lot of couples. So in rehab, and specifically physical therapy, we do work a lot on fatigue management. And what I like to encourage my patients and my couples to use is that 0 to 10 scale that we're all familiar with when we refer to pain. But it's a 0 to 10 scale for fatigue. So 0 is, I'm feeling pretty good. Let's do whatever you guys are up for. 10 is like, wow, you could knock me over with a feather. I'm exhausted. So sometimes rather than saying, I feel overly fatigued. I'm so tired. I'm so tired. If you feel like a broken record saying that over and over, you can just say to your loved one, hey, you know what? I'm at an 8 right now. And your loved one can say, oh boy, okay, I know he or she's at an 8. We need to order pizza and call it a night, put on the comfy slippers and the comfy pants, right? So I think sometimes using fewer words and having these types of scales can actually just be easier and more relaxing for sometimes people to convey that fatigue and that exertion.
That's great. Thank you so much, Mandy. And Lucy, as I mentioned, cognition is a big concern for people. And this person in particular wrote that they're scared to even start a conversation, especially when dating or kind of in a social setting, because their memory is getting worse. And that's just really scary to start a conversation when you know that your memory may not be as sharp as you hope it would be. Do you have any tips for improving memory, or to kind of how to adapt to those social conversations to not be so scared?
Yeah, no, absolutely. That's a great question, because we know that cognition changes can occur, and like we said, 65% of people living with MS. And so I think it's important to recognize, those areas of cognition that are often affected by MS, but also too, let's recognize that there's areas that are still not as affected by MS. So one thing that I was thinking about was conversation skills, long-term memory. Those tend to be pretty well preserved in individuals living with MS. And so when you're thinking about being in social situations, as you start to become more and more self-conscious of maybe some of those changes, that's going to have a really big effect, right, on your ability to kind of get out there and socialize and engage with others. So I would really encourage one to think about kind of the emotions that are also kind of interacting with the cognitive changes. And if we can manage the emotions, oftentimes we can better affect, or we can see maybe some improvements in cognitive functioning. So thinking and talking with your healthcare provider about maybe cognitive rehabilitation could be one way to compensate. If you feel like professional assistance might be helpful. Another thing too might be in these social situations, again, if people that you feel comfortable with, maybe you just kind of put it out there like, hey, I'm having a little bit more difficulty with my attention, with my memory, kind of bear with me. I might ask some more questions, or I might ask you to repeat yourself, and you might find that your friends and loved ones say, that's okay, all right, no big deal, like I want you here. That stuff isn't as important. So I think it's really clarifying the struggles that you're going through with those closest to you.
And hopefully we got some ideas of some of those healthcare professionals and support network members that can help with memory and those other issues. So that's great. Thanks, Lucy. I want to get to two more questions. We're running a little bit into overtime here, but real quick, Mandy, you had talked about communicating with a healthcare team, and you touched upon insurance and how that's just kind of a reality of the care that's out there. We received a few questions of sort of the frustrations of talking and advocating and navigating with insurance companies. Any specific tips of how to communicate with insurance providers? I know that's very specific and individualistic, but any sort of broad tips for the insurance side of things, and how we could communicate with them to self-advocate?
Yeah, I mean, navigating insurance is tough and confusing and tricky, and like you said, Brian, it's individualized. But I do think two resources that people could consider exploring: the National MS Society, 1-800-FIGHT-MS is the MS Navigator call center line. Call them. Sometimes they can answer some of those broader insurance questions for you, especially if they pertain to MS specifically. The other resource that might be helpful is calling your insurance company directly. Sometimes when folks have complex conditions or complex medical situations, you can either ask or request for like a nurse case manager, and every insurance company may call it something different, but basically asking for someone from that insurance company to help kind of guide you and be a liaison and help explain things that may be too complex or complicated to understand on your own. So those might be two resources to explore.
That's great. Thank you. The last question is actually a question that we've received from at all of the webinars in this series, and the reason why we're having a young adult series is there's so many resources out there that's kind of geared to older people living with MS. And this question is actually coming from someone who's 16, and they're saying that All the resources are out there, nothing really specific to younger people, and oftentimes they'll go to programs and be the youngest one there by decades, and that can make it really isolating and even embarrassing. So any advice or resources or tips specifically to that younger audience of how to navigate this uncertain future, and the communication conundrums that go along specifically with being younger and not having a lot of resources geared towards those concerns in that age group?
So I can take this first, Lucy. So I think this is just a shout out to Can Do MS, right? Like, we need to offer more programs focused for young adults. But I would also encourage young adults to talk with their healthcare providers and say, hey, I feel really alone. I feel like I don't know other young adults who have MS. Is it possible, obviously observing the confines of the privacy laws, is it possible that we could figure out a way that I could connect with other individuals who are also young living with MS? Are there any other local ways that I could connect with other young adults similar to my situation? So your healthcare providers might be a good route to venture down and talk with as well.
That's a great suggestion, Mandy, and I think certainly one that's worthwhile to consider. Another thing I was thinking about is contacting your local representative from the National MS Society for your local area. They might have some suggestions for programming or ways to connect you with other individuals who are younger, and they might have some ideas as well, or maybe know of some programs that could be applicable.
Great. It's a great starting point, and I really appreciate those resource ideas and suggestions. So again, thank you everyone for submitting those questions and everyone for joining us tonight.